A new report reveals the increased success doctors are having with early intervention for babies born preterm.
The study, led by researchers at the Ohio State University Wexner Medical School, shows that this success extends to infants born at 22 weeks, which is considered the cusp of viability. According to the report, active treatment increased an average of 3.9% each year between 2014 through 2020. However, the study also found the decision to initiate active life-saving treatment fluctuated because of the age, race, and ethnicity of the child. Let's bring in Dr. Kartik Venkatesh now for more on this. He is a high-risk obstetrician and perinatal epidemiologist at Ohio State Wexner Medical Center. He's also an assistant professor of obstetrics and gynecology at the school and the lead author of the study. Dr. Venkatesh, welcome. So what key points does this study talk about for babies born between 22 to 25 weeks and 6 days?
Thank you so much for having me today. What the study really tells us is that periviable birth, as you say, which is between 22 to 25 weeks, accounts for nearly 40% of all neonatal deaths and frequently occurs amongst racial and ethnic minority communities in the United States. What we do know that is promising is that intervention for these infants has increased across the United States between 2014 to 2020. However, we note there are persistent differences and disparities by maternal race and ethnic group, such that Asian, Black, and Hispanic mothers are less likely for their infants to receive medical intervention at birth compared to white mothers during this periviable period.
And Dr. Venkatesh, exactly what types of interventions are we talking about? We're talking about obviously preemies, right? These are babies that
That's
are
exactly right. What we're talking about is the most preemie of the preemies, those who are born at what we would call the cusp of viability, often as early as the 23rd week. And the interventions we're talking about are being able to resuscitate those infants. And these interventions vary from intubation, where surgical airway is provided to the neonate, as well as antibiotic therapy and surfactant therapy and other interventions that can potentially be life-saving.
And so did this study examine potential causes of these disparities?
One of the strengths of this study was that we were able to take a look at all births that are occurring across the United States using birth certificate data, which really provides an ability to look at what's going on in rural areas, what's going on in smaller communities and hospitals that may often get missed by studies that occur at tertiary care centers. But using these data, it's challenging to pinpoint why exactly we see these differences. So it's a call to action for more work to be done in this space to address maternal and neonatal disparities.
So what steps do you suggest can be taken in order to improve the outcome for all infants born between 22 and 25 weeks? Because it sounds like part of what you're saying is that some of these births occur in hospitals that are so small and have such limited resources that, these mothers and these infants are not able to receive the immediate care that preemies this young need. Is that accurate?
Right. That's accurate. So, there are national efforts underway, including guidelines to provide services to mothers and neonates born in this period so that they can be transferred potentially to hospitals and tertiary care centers where care can be provided. Certainly, we also need more research to pinpoint and understand why we see these differences, in care delivery. Are there differences at the level of individual hospitals where care is being delivered? Are there certain provider characteristics that may explain this? Is it, so certainly we need more data and we need more research in this space. And then on the patient side, we also need more research with regards to shared decision making. These are complicated, life-altering decisions for mothers and their families. And often these decisions have to be made in minutes or hours without necessarily much preparation for families in terms of what intervention they may or may not want. So I think we also need we need more data, we need more research, and we also need more work to be done in terms of understanding how we can best provide for shared decision-making between patients, families, and their providers in this very difficult situation.
Well, it sounds like your study is a big step towards understanding this sort of multifaceted problem and situation. Dr. Kartik Venkatesh, thank you so much for sharing your insights with us.
Thank you for having me.